Korean 10-step program. Today I'm not coming to you to talk about Korean skincare, but I'm coming about something else. I'm a physician at Grady Memorial Hospital in Atlanta, Georgia, and I wanted to talk to you about my number one ask from people during the COVID-19 pandemic. That number one ask is for you to stay at home. To really stay at home, to isolate, not have people over, not go out, and just stay and bunker down for now. I see a lot of posts on Facebook still asking about traveling, getting on planes and going on vacations, whether you should have play dates, birthday parties, going to nail salons and getting your hair done, and it's starting to drive me crazy. These things are not necessity, and what they're doing is helping spread the virus. The conversations we have in my house aren't about whether we're going to have a play date, who we're going to go play with, who we're going to see, what we're going to do, whether we should get our hair done, our nails done. It's more about, if I get this virus myself as a physician, what I'll do with my son. 2 weeks ago, I asked him on the way home, after I saw my first patient, who was a person under investigation, after seeing that person for a good 7 days, not thinking that they could potentially have COVID, it wasn't so much on our mind. Once they got under investigation, it really changed how I thought about things. Right now at the hospital, I'm sure everyone has seen this already, is that we don't have enough personal protection equipment. I wore the same N95 mask from March 1st to March 15th and expected to keep on wearing it. I wore the mask whether I was going in with the patient with the tuberculosis or ruling out tuberculosis. I wore the same mask when I went into the person who has now confirmed COVID-19. Of course, when I saw the patient with confirmed COVID-19, I did have on a surgical mask over and a face shield, but we really just don't have enough equipment. It's not recommended that we use those masks over and over again. I want everyone to stay at home to stop the spread of this so that we can just flatten the curve so that the healthcare system has a time to catch up. The equipment I do have, if you look at what the doctors are wearing, the nurses, the medical assistants, everyone is wearing here in the United States, it's a yellow paper gown that we wear traditionally to go see an isolation patient. We wear a mask, we wear a face shield. Most of us don't have anything to cover our hair. If you look at what everyone else in other countries are wearing, they're wearing complete jumpsuits. Everything is covered. You can barely see any skin on their face. We don't have that same equipment. We feel unprotected. We feel scared. Not only for our patients, which is normally if we feel fear what it's for, but right now we're feeling scared for ourselves, our safety, our families. And we really need you guys to bunker down, stay home so that you don't go and get infected too and then come into the hospital system. People asking questions about should they have their cleaning service come in and their cleaning person come in. My answer to that too is absolutely not. We know that the virus is spread through fomites, so that if someone comes in with equipment that they've used in someone else's house, or that the virus is on their clothes because it can live on surfaces for days, that then it gets in your house and can potentially infect your family. It's really not worth the risk. Nail salons, your nails will be okay, your feet will be okay. You shouldn't be going out anyway, so hopefully no one is seeing that because you're not having visitors over either. For play dates, please don't play with other families. Isolate within your own family. Stay within your own home. Don't spread it from family to family. The other thing I'd ask that if you are around vulnerable groups, people over 65, people with diabetes, people with hypertension, stay away from them. I haven't been around my mom since February 29th. When I started the inpatient service on March 1st, I knew that the potential for exposure would be there, so I haven't seen her, been around her since. My son, who lives in the house with me, because there really isn't too many safe places for him to go. Most of my friends are physicians, my friends have kids. He's been exposed to me this whole time. I don't feel it's safe to then have him go stay with somebody else, though I thought of it. Trying to social distance with him at home is hard. I'd ask for those of you who are still doing homeschool, the actual teachers, to be sensitive of this. with your kids who may not be turning homework assignments in, who may not be completing assignments correctly, because a lot of the parents just can't focus to do them with their kids. The kids are scared too, especially those healthcare kids who know that their family members, their parents are still going and working with people and potentially bringing it home. The conversations we have in my household are, if something happens to me and I can't come home, if I end in the hospital, where does my son want to go? And we talk about that. We have a plan now. The other conversations are, let me show you where all the paperwork is in the house in case you ever need it. So he now knows where my will, my power of attorney are. And he now knows what those are and what that means. And I like to say that if you are someone who is normally getting your hair done by the same person, getting your home cleaned, getting your nails done, to still give them those checks, especially if you're still getting a check so that they can live and pay their bills too. Don't forget about them. We need to keep this a village and make sure that everyone keeps going on. Other ask, if you do have N95 mask, please consider giving those to a healthcare worker that you know, a nurse, an MA, someone who's working at the front desk, cleaning crew. We need them to stay healthy. They need to stay safe. They need to stay alive so that we can continue to treat this virus as we see more cases and we see more deaths. Many people feel like their kids are going to be fine, and more than likely your kids are going to be fine. But as we saw yesterday on the news, there is a 12-year-old at Scottish Rite who is sick in the hospital with COVID. I read the data on children in COVID. Most of it was good, but I stopped reading when I got to the death of the 14-year-old boy who had the disease. It just made everything so real. And it increased my social distancing that we do at home, which I'm sure you can imagine is hard. It's just myself and my son in this house. I'm his only parent, so I worry. Right now also, no routine doctor's visits. Don't just go up to your doctor's office, do telemedicine. Most places I know of that are seeing patients, they will convert them to telemedicine calls. Even at Grady, people are calling, have primary care appointments. We're converting those to virtual calls, and we're calling them and discussing what they need, if they have any concerns, refilling their medicines, and keeping all of those things going for them so that they stay healthy and out of the healthcare system. We'll say if you do feel sick, if you feel short of breath, have trouble breathing, please then, it's time for you to seek medical attention. But until then, if you're just feeling a little bit sick, have the sniffles, stay at home. There's no way for us to even check you to see if you have COVID-19 in the hospital. Don't come to the hospital asking to be checked if you have mild symptoms. We're not checking you. We can't check you. Final thoughts is just for all my thanks and prayers to everyone that has to work. Think the people who pick up our trash, they have to come, they're risking their lives. The people who are working in the grocery stores to make sure that we have vital things that we need. Every single person in the healthcare chain, from the people who are the receptionists and greeting people at the desk, to the maintenance people who are making sure that our hospitals stay clean, services stay clean, disinfecting, to the people who are delivering food to our patients, to the medical assistants, the doctors, the nurses, and everyone who's on the doing care face-to-face with patients. Even the hospital administrators who are trying to get us our personal protective equipment and what we need and making sure things run during this time. Thank you. I'm praying for you. And that is it. My plea is just for please for people to stay home. Thank you, and hopefully next week I will